we're on here. To me, what's inspiring is seeing how many therapists there are who are committed to A, deepening their own knowledge, and B, really improving their own clinical work. We had like the 3-question form, which I'm going to be going through some of the questions that I can about what people want to get out of this conversation, this masterclass. And what I am left with is like how lucky we are to have access to knowledge, and really how lucky your clients are to be working with you. Okay, so briefly, this masterclass is the empowered therapist. Now, before we dive in, I'm gonna ask you all if you can just feel your feet on the ground. Kind of put your heels on the ground, just get in touch with gravity. Notice your posture, if it's hunched over or if it's long, kind of just play around with it. Find a position that feels comfortable. And then just notice your breath without trying to change it. So I like starting with the deep exhale. So, and then a deep inhale. Now we are going to begin. My goal for you in this is really to just give you some information. A lot of you have a lot of knowledge, and some of this might be new for you. Some of this might be refresher. I always say that repetition is the best teacher. Just briefly about me. My name is Esther Goldstein, and I am an anxiety and trauma therapist. I own and run a group practice. And I kind of landed up in the trauma field by accident. I worked with a lot of clients who had addictive tendencies or, kept relapsing in certain behaviors. I don't love the addiction term. But what I started looking at is, why are some people able to hold sobriety in terms of love addiction, drugs, alcohol, even electronics, and some were able to hold sobriety or live more functional lives. And a lot of what that came down to was trauma, right? That are the internal template and the things that came in the way. Now, that doesn't mean like, oh, you have trauma, there's no hope for you. But then what led me to was, then I need to come up with the right kind of skills, the right kind of training that I can actually help myself feel hopeful, because then I wouldn't want to stay in the field, and also help my clients start actually feeling hopeful about their lives. Now, that doesn't mean that overnight they started healing, but what that does mean is that over the next few sessions, there was a lot more clarity about what direction we were going in treatment. And I know for my own self, which I'll talk about this more soon, it really changed for me, my own healing. I had a lot of belly anxiety. I had a lot of stomach anxiety, body anxiety, and generic talk therapy wasn't helping. And until I found my own therapist that was able to help me, I kind of was feeling like, how can I stay in this field if I can't actually resolve my own psychosomatic pains? And so a lot of this is really, here I am talking as a human, as a person who's done a lot of my healing, and really getting to the core of what's going on for our clients. Okay. Identifying. So the 4 goals that we're going to be looking at is identifying your core goals, examining difficult cases, tools for transformation, and a deeper look. The next level, I have a trauma training consultation group, which I really committed to supporting therapists. So one of the things I'm going to ask you to do is, if you are comfortable, dropping in the chat box, and then unmuting yourself if you're comfortable being brave, just who you are and what brought you here, what brought you to this masterclass.
Should I start?
Yeah, please do.
Okay. Thank you for the invite. This is wonderful. I came in through your training, I guess by accident, because my work has been primarily in the rehab psychiatry with individuals that have severe and persistent mental illness. But after I finished my work in the hospital, I had been devoted most of my time in my private practice, and trauma has come over many times. And one of the things that I notice is that it's very entrenched, and most of the time, the patients want to sort of go back to the original experience that were traumatic, almost as if saying it and repeating it and going over and over, they hope to master what happened to them. So I wanted to sort of have the opportunity to see if this is something that is unique of my practice, or is it something that you have also noticed, and are there specific interventions that might facilitate the process of moving forward from that original trauma in a way that they can integrate what had happened, that there's nothing one can do really to change the past, but there's a lot of things that one can do in the present to make your life differently and better. That's
Yeah,
in essence.
I love what you shared. So essentially, are you saying, thank you for being here. Um,
You're welcome.
Essentially, are you saying that like your clients basically are coming in, want to help them move on, but it's almost like the past and the present are getting like collapsed? And so, because that's what happens, right? Like,
And they don't want to let go.
right. So,
Almost.
right. And then there's almost like what you're saying, there's almost like this like obsession or this like repetition compulsion of like not right intellectually or emotionally of like I need to go back here, right? There's some people who run away, and the
Mm-hmm.
running away is a different form of coping. But you're saying some have this compulsion of like I want to come back here, I want to come back here, I want to come back here.
Mm-hmm.
And I get curious, which we'll look at this more, is like sometimes there's a way to talk that's helpful, but
Mm-hmm.
sometimes it almost creates more like catatonia, like it just makes the person kind of feel stuck. And
Mm-hmm.
so we don't want like the repetition compulsion. What we do want to do is look at, do they want to repeat the story because like what you said, they want to master it? And then essentially what unconsciously the client might be looking at is they want to master the inhibited survival response, the fight flight response or the freeze response that didn't happen. So meaning, I'll just go briefly, we'll talk about this more, but briefly, like if a client keeps telling me something and they keep repeating it and repeating it, but they were with a partner who never really had the capacity to hear, they had the need, right? Because there's fight is kind of like pushing away or
Mm-hmm.
using words, flight is running. Okay, I'm just going very
Mm-hmm.
simple. So if somebody tries to fight like their words and share words and the person didn't hear, them
Mm-hmm.
telling me 10 times what they wish their partner heard is not going to help if I'm not working in the right kind of way, if I'm not setting up the treatment in the way where they're not dropped into the self state, which is like the part of them that was in that experience. Only when I properly do that and I get in touch with the core need and help
Mm-hmm.
them understand the core need, then we could engage in that maybe a few times and then you resolve it, or else they're just going to be right. You see those people
It's spinning around. Yeah.
spinning, right? They're
Yeah.
in this compulsion. We see this with people in relationships, right? They're always shouting, I can't help it.
Mm-hmm.
You can't help it because you're stuck in this like cycle.
Mm-hmm.
And what we want to do is help the brain and the body actually resolve it, move
Mm-hmm.
through it.
Mm-hmm.
But I like what you're saying. Essentially, I mean, essentially the client is trying to come to a place of completion, but part of it is helping us look at what is it that they're trying to complete.
Mm-hmm. Or is it that they're trying to gain power? Because oftentimes what I've noticed is that the trauma had been inflicted and they were powerless. You know, if they were very young, they didn't have the the skills to
Yeah.
sort of stop or get out of the situation that was very traumatic. You see,
Yeah.
is it that the sense that repeating the narrative would make them more able to sort of control what happened to them? Because it's very troubling in that sense, because that's not
Yeah.
really what's going to happen, right?
Yeah.
Um,
Right.
so so I'm wondering if, yeah, uh, I have to be very tolerant also with myself, because I'm almost feel like I've been vicariously put through sort of a traumatic experience indirectly, because I had to listen to this over and over, and I said, "Oh my God, when are we going to move? When are you going to move to the next step? You
Right.
know,
Right.
to be more in control of what you have in front at this point,
Right.
you know?"
Okay, you're giving me such rich content, which we cover a little later. So
Okay.
essentially, by the way, to answer your question, and then we'll go on to whoever else might want to share
Okay,
before we go
sure.
in. Essentially, by the way, it's two in the same. They want to get mastery and they want to feel powerful instead of powerless. And by the way, when you actually help them, Peter Levine, right, who's the creator of Somatic Experience, talks about reinstating an act of defense. You pushed me down physically. I want to be able to push you back. And there's actually like physical movements that you could do with your client in terms of the push. And then Pat Ogden, who's the creator of sensory motor psychotherapy, says, okay, reinstating an act of defense, right? Wanting to come back to be a master or to feel powerful instead of powerless sometimes isn't always like a push or a shout. It's more of like something called somatic sequencing, where you're allowing the body to move through the trapped sensations in the body. Because when we get trapped, that's where we feel kind of frozen and powerless. So essentially, by the way, what you're saying, it's two in the same. They want mastery and to feel less powerless and powerful. But the question you're asking actually gets answered by like this two-sided cookie, because essentially like helping to work with this feeling of stuckness or whatever the trapped feeling is or powerless feeling and helping them gain mastery is what's going to help them. The piece about you I want to go into soon, because right, a lot of times we get frustrated or concerned or confused, or I know I've had a lot of secondhand trauma, but let's talk about that a little more, because I actually think it's going to be helpful. Like when we feel clear on where we go with clients, sometimes it helps us feel a little less like sensitive to the experience when they kind of are getting stuck in a loop. But I love this question and your openness, and thank you. So rich.
Thank you.
Thank you. Okay, who else wants to share? What brought you here? Anyone else want to chime in? Malka Cohen, you want to share what brought you here?
Hi.
Hi.
I put in the chat that so I not so dissimilar from, I'm sorry, I forget the man who just spoke.
Frank.
Hi, Frank.
Hi.
My name is Malka Cohn,
Okay.
by the way. I'm a practitioner in Rockland County. I've also worked in the substance abuse recovery or substance abuse treatment. Right now, I find I have quite a few male clients who struggle with different kinds of, I don't know if you want to say some addictions, some compulsive behaviors that are, I think, very compensating for a lot of difficult feelings, and some of them it's trauma. I think it's not everybody has such an easy time making the connection or wanting to look at the trauma. They're very focused on their partner's role, themselves as a victim. And, I know these things, move slowly, but I would just like to understand more about, how to sort of create like a pathway, to help patients sort of understand themselves, and then maybe consider what other options they might have instead.
Do you mean to like deal with like either like the victim mentality where they feel kind of powerless and then angry, because that's the easiest thing you can reach for. It's like the lowest hanging fruit, and you want to honestly help them go higher, where it's like, let's actually look at yourself in the mirror, but something feels too frightening or too far away or impossible. And then the other piece you're talking about, somebody else here wrote about sex and sexual trauma. You're saying like other ways to maybe cope with the discomfort or the pain instead of some of the obsessions or compulsive behavior. Is that what you're saying?
Correct.
Okay.
Yeah.
Awesome. Wow. You guys are all like so intelligent. I'm excited. Okay. So we're going to dive in. If anyone else wants to chime in, I see the chat. I didn't see it before. We are going to chime in. So here I just put in, you aren't alone. The path to greatness is closer than you think. What we're going to look at is like unlocking clarity for yourself and then also for your clients. I just want to say, like, I started out and I remember feeling so lost. I think I was so ashamed at how lost I felt. I felt like, here I am being a therapist. Like, I know what I'm doing. I did a training, I did post-grad trainings, and I would sit with clients and there was like this insecurity or lack of knowledge that I would have. And I'm like, there's no way they're not picking up on it. And I can't just nod and smile and try some of my generic interventions and even my advanced ones. And then I kind of, for my own like anxiety, reached out to some experts, and I was like, I need consultation. I think I really want to refer all my clients to you, but if not, could you help me out? And they were like, we don't have space on our caseload, but if you want, we can help train you. And I remember saying, like, are you going to tell everyone I'm a phony? And they're like, no, because like actually the ones who are not reaching out for training or consult, I'm more concerned about. So I feel like there's something very powerful about like, one, like knowing that there's nothing wrong with not knowing or wanting to grow. I know for my own self, the people I respect the most are always like hungry and thirsty to learn. I've gone to trainings that I thought I knew all the skills, but like hearing it again, a little bit of a different language or some kind of sentence, I end up borrowing, and it really helps make a shift. So I really love like the humility of anyone who's open to learning. So thanks for being here with me. So what we want to do is trauma healing is make the world a better place to exist, right? Like there's our own knowledge of ourselves and our nervous systems. There's having a map, like what we just spoke about for ourselves and for your client. And then obviously global impact, because at the end of the day, the more we have language and conversation around trauma or symptoms or anxiety, or even like in intimate partner dynamics or communal dynamics or sexual abuse, right? Or like I just put out this blog the other day about like when people get, they have these like emotional tantrums, right? And where they kind of get stuck in younger phases of development. So I think just like normalizing it really gives people more hope and capacity. And so I think one of the biggest pieces, okay, here we're going to talk about examining a case before I go into it. One of the things I like asking therapists is like, what are your strengths and your struggles? But what I'm getting a sense on is like, from the people who I've looked at the applications or people's input, is that there's a lot of knowledge and wisdom, but sometimes it's like knowing like, where do I go? What's most important? Where do I start? And then where do I go from here? So I'm going to give you some information. I will share that part of my passion to share knowledge and training is that there were times I was Googling, like, how do I help a client with chronic dissociation? And I didn't find much. And so I ended up putting out a lot of blogs. I think some of you might know. Like I have a blog that has between like 70 and 80,000 hits a month. And it's not even people in New York. Wow. I'm located in New York. But people around the world, and when they say like, thanks for writing about body flashbacks, like one guy said to me, I was going to go to the hospital, and then I realized I was having a panic attack, and it was a body flashback of feeling very trapped when I was younger. Thank you for putting this information out there. Why am I saying this to you? Because you learning information, you're also giving your clients a way to feel so less afraid in their own minds and bodies and clearer about where they can go. And I don't want to undermine that, because you know how they say, I want to just give power to that, because you know how like I've seen posts that say like prevent suicide, like here's a 1-800 number suicide hotline, and then they say the real way to prevent suicide is psychoeducation, make sure people have weekend plans, treat anxiety, right? Talk about the implicit effects of like psychological abuse. So I just think like knowing the things we speak about in our families with our clients is really powerful, right? There's a difference between like hope and not hope. Okay, so before I even go into the structure of good therapy, what I want to say is navigating roadblocks is what I think most helpful for successful outcomes. Have any of you had times where you've gone to a training? I know I'm always that person, and you hear about this like incredible intervention, but then you raise your hand because you're thinking about applying it to a complicated client or a complicated client presentation, and they don't always answer the question, or you just wonder, how is this going to help me? Have any of you ever had that, where it gets more complicated when you want to apply it to a client? I just wonder if anyone's ever had that.
I had that.
Yeah. So what I found is like one, and I tell this a lot of times to clients, but like I was in a training for EMDR, and I'm actually writing a book now with the new Harbinger. I think I mentioned this a few times. And they asked me, what title do you want for the book? I said, I want to write EMDR for rebels, because EMDR alone, I'm like, I think you have to know how to be rebellious once you have the skills. And they're like, no, it's too provocative. I'm like, but here's the thing. Generic EMDR with complex trauma, generic somatic skills with complex trauma, it doesn't work, right? And like it's being able to understand, is my client stuck in a child state, right? Here's the 50-year-old who's brilliant, but all of a sudden he's sitting in the corner shaking in terror. What do I do? But then he comes in and he's angry at me sometimes. So like, what's going on, these fluctuations? Why is this person feeling so stuck in this like victim mindset when I see that they actually have resources, or I wish they realized they had choice and they don't feel like they have choice? So how do I bring them to that choice point? So I'm just saying that navigating roadblocks, like sometimes we'll come in with this intervention or we'll have a conversation, and all we have, I know I've had this sometimes where I'm like, hey, we started a conversation and like all I see is like yellow tape, like the road is closed, here's a pothole. And I've told my clients, like, I feel like I can't really go anywhere. Or something about the way I'm saying this, like my hands are tied behind my back. Something about the way I'm talking to you or about this, it's not landing. So what I usually think about is, wow, this client must feel incredibly trapped in their life. If that's how I'm feeling, they must feel incredibly trapped. But instead of like stopping and saying, okay, I give up, I just say, okay, I actually believe everything is figure outable. Just had this conversation with my son. And he's like, no, it's not. I said, listen, sweetheart, some things might take a week, some things might take a month, some things might take a lifetime, right? If I'm incredibly poor, but I want to start building family wealth, I might have to start doing small steps, but I'm creating a new neural network, right, in my brain or for my children that maybe they'll know that they have choice points or the ability to save money in a way that generation before didn't. So I really like thinking like, where's our choice point? Now, here's a picture that I have on the right where I put in, when we have roadblocks, often our clients are stuck in threat brain, right? Like I did this training at LaGuardia. It's this airport terminal, Terminal B, and they basically had their staff were under a lot of pressure, and they found like the staff were having a very hard time performing. And I said, like, let's just look at, are the employees stuck in the fight, flight, or freeze brain? Because if any kind of employee or if any of us or our clients are stuck in threat brain, which is like right here, okay? If any of you want, I can show you some images of this. We're going to be stuck. Okay, so if a client has anything where they're stuck in fight, flight, or freeze, they're going to have a hard time engaging in therapy. I remember I once had a client who said to me, by the way, the last 5 sessions of EMDR, I wasn't there. She was pretending to me that she was present. And I was like, first I was insulted. And then I'm like, okay, something about the way that we were pacing wasn't right. And so we want to get the clients into safe brain, right? And then also eventually into drive brain, which basically just means that they're present in the experience. Now, present for me is like, even if we accomplish 1% of shift in a session, right? Or over 5 sessions, that's called success, because 1% plus 1% is moving along, right? I don't want to pretend like, and I do want to say, just because I know that we're also human beings here, there are times that we work with clients. I know for myself, I remember once speaking to a supervisor and I said, I want to sit down and cry and pull my hair out. And she's like, why? I'm like, because this client, I guarantee you, the best I'm ever going to get them to is not a place that I feel excited about. Like, here's this client, and I know that for his capacity within 6 months, like I've seen how far he's come, and his life is going to be like so incredibly sweeter than it is. And this one, because of the relationship he's in, because of the burdens he has, because of the family, like it's very hard. And I remember she said to me, like, we need to sit with your anger and your grief about the struggles that your client has, so that you can actually like hold those emotions. So when you show up for him, it's kind of like being a parent or being an educator, right? This one is going to have a completely different roadmap, but you still can help them. But you need to negotiate your expectations. And we talk about this later with Dr. Scott Miller. He looks at the research. It's hard, right? Frank, what do you think?
Yeah.
What's the hardest part? Like, as you're hearing this, what's coming up for you?
Well, sitting with it, like you have that feeling internally, and it makes you wonder if I'm going to be able to really help this person, and how do you put what's going on internally with you to the side so that you can then work with the patient? That's the part that is very hard.
Yeah.
I mean, how do I screen it?
I know. I think the fact that you're asking this question means that I get the sense that you're very self-aware. So there might be clients that, like, when they come in the room, before they come in the room, there's almost like this part of you that comes forward, right? That more than with other clients. Like, there are clients that aggravate or wake up a part of us.
Right.
Right. And so I think my experience is like, sometimes like in this consultation, it was like, I didn't even get to talk about the client. And I was like, wow, what a waste of time. She's like, excuse me, this was incredibly helpful because I helped you. And if I help you, I'm helping your client. And it happens to be like over time working with my own impatience and my own fear, right? It was much more about me and my own worries about areas or people that I loved, or this uncertainty about parts of life was really where I needed to grow the capacity to tolerate and to be with. But that doesn't mean that I didn't get clear. I also looked at like, what are my treatment goals for this client? And we'll talk more about this soon, because I also then recommitted to how do I map treatment goals? And I needed to make a much thinner slice of a treatment goal with this client. Like I tracked like 5% less anxiety, or a marked capacity to move through body flashbacks or moments of anger over the next 3 months. And that helped me because I started noticing shifts that before I wasn't able to notice, because I was looking at like much bigger slabs, right? In some clients, it's much thinner. And sometimes it's not the right fit, but I think that there's like looking at the pieces a little differently. But I love how you said about like the part of the therapist, because we'll dive in a little bit more. We talk about that soon. So just some speed bumps I want to talk about, like expecting bumps for a smoother ride. I think that like when we expect, to go on a smooth ride and there's speed bumps, or if there's flooding, like we get angry, we get irritated, we get annoyed, right? And it's just like, oh, like I thought this was going to be smoother, or oh my goodness, what am I going to do from here? Should I even be in this field of work? Or am I too triggered? Or are these clients even helpable? So I think like learning about the normal or the expected bumps along the way helps us feel more like, even if I don't have a full solution, I know where this lands intellectually or clinically. So I'm just going to name a few that I want to just talk about that I've learned over my time, and I'm still learning about. But one is phobic avoidance. Phobic avoidance of an inner experience. And I'm happy for anyone who wants my resources. I go more into this in some videos in my trainings. But for right now, phobic avoidance is basically like, sometimes we tell a client, I noticed that you have this child or this part of you that feels very alone. Can you close your eyes, or can you hold that young one in your arms, and can you just love on it, or say like I'm here, or can we just notice it? Now for some people, doing that kind of inner child work or having compassion, they can do that, okay? But that usually means they had a very secure, nurturing adult or someone in their life. Most of the clients I work with have a very hard time being that nourishing voice. They usually have this thing called phobic avoidance of our inner experience. They're like, ew, gross, yuck, oh, I don't know, it's too much, don't give me that. They like throw the baby back. You know what, Esther, you love on it. And I'm like, ooh, wow, I just kind of, I touched something sensitive, huh? So I think like when we expect our clients to have this like calm and smooth inner system, when actually there's usually this layer of phobic avoidance, could be like, it's very uncomfortable and they almost have this phobia, and they almost have this avoidance reaction to either, it could be from a trauma, or it could be an emotional need and a need to belong, right? Especially with addicts, there's usually like a very high level of emotionality and needing soothing, almost like they have this like inner judgment. And so slowly working with the part of them that has opinions or a reaction to the core emotional need is so important, because if I'm going to push that client to be loving on this emotional need, they're just going to feel worse. And so what I say is, oh, wow, okay, it doesn't feel right, huh? To ask you or to notice these feelings in like a big way. Okay, so could I'm just gonna tab in my mind for a future, like there's some very big feelings here, and wanting to feel like you belong or wanting love is just FYI a very normal need. But I'm not gonna give that job to you right now. We're gonna work on this slowly over time, okay? I'm gonna help you with it, right? They might roll their eyes, or they might say, oh, that feels much better. But essentially what you're saying is, I see you. It is gonna be a little bit more specific, right? And specifically with like parts work, sometimes I'll help a client notice, like even just noticing these two parts, right? Like, wow, so you reached out to your friend. He wasn't very welcoming. You felt so much shame and like you didn't belong. And then you were just beating yourself up for even having that need. So even just noticing what's happening internally, and then you use the alcohol. Or then you came in very angry telling me like, we need to move quicker in therapy, huh? So let's just notice, right? So just the phobic avoidance, I think, is important to notice. In therapy, sometimes what I'll do, or in trainings, is like using attachment-oriented interventions. And that doesn't mean that I'm becoming the loving mother figure for my clients. But what it does mean is that I slowly start looking at working on the layers of avoidance inside, so I could lessen their need to avoid themselves. We don't jump to like, I'm going to give you a hug, right? Like for a lot of our clients, they don't need love. They need the absence of constant terror, the absence of constant shame. Like, let's just first like remove the constant pain. Then we'll talk about adding like people say, I'm in a horrible place. You think you're going to help me? I'm like, no, I can't get you from horrible to good. I could get you from horrible to hard. Are we good? I'm going to get you to hard. Like, it's like, I want to get you from complex PTSD to PTSD. Tell your friends that like, I'm not such a good therapist. I can only get you from the complex to the PTSD. Life's still going to be really hard, but it's going to be a little better. Could you work with me? If you know anyone who could get you to like happy and joyous, give me their number because I want to go to them for myself. But otherwise, here's what we got. You know, so, okay. The inner conflict is kind of what we were just talking about before.
Thank you. Let me do this. I'm listening.
Okay.
She's
awesome.
good, this girl.
So inner conflict is that there could be one part that wants healing and another part that's afraid of the losses. So sometimes I'll have a client that says, hey, listen, I want to come in here and I want to work on this part of me that's very needy, right? But there might be another part, and we start doing some work on like, you know, noticing what's happening in their body when they want to reach out to that person, text them, the person who, you know, was ignoring them, or whatever the needy behavior is, or the grasping behavior is, right? I think I did a recent blog on Bonnie Bainbridge Cohen, talks about these 5 neurocellular patterns. And sometimes when you think about a client, you want to think about which one do they have a deficit in. Yield is like this conscious alertness, just being able to settle. Sometimes our clients who never were able to settle in utero and settle down are constantly in fight or flight, have to be busy because they don't really know how to be. Maybe they never had relationships where they could just be. And your goal as a therapist is really just to have a place to help them be. And somatically, if you work somatically, there's ways to kind of help the body really just like go from movement to settle. But I'm going to skip ahead. Some clients are in this constant place of like grasp and reach. They're constantly needing and grasping. So usually someone who had like an unmet need, or like had, I always say it's like eating, like they had 5 plates of noodles, but they never got protein. So you're shoving them, right? It's like they're starving. And somebody says, I'm starving. And I'm like, that's so interesting because your belly's full, but there's some part of you that's still starving for an unmet need. I want to help you. But let's say there's someone who says, I want to work on this, okay? There's a part that wants healing, and there's another part that's afraid. But if I actually engage in this healing, or I make a shift on this part of me that's very graspy or needy, I have a fear. And usually, so they might come in and start doing the work, but then all of a sudden I'm like blockaded, right? Or all of a sudden they tell me I'm not helpful or whatever, or they start coming late to session, or they cancel me, or whatever it is, right? Or they start talking about Tom, Dick, or Harry, and it's just like, I don't know what happened, but suddenly you're in a different lane. A lot of times there's another part, you might want to say, it's so interesting, we started working on blah, blah, blah. And I wonder if there's some other part or some worry about us doing this work. Because sometimes there's another part that says, okay, I know I could be needy and graspy, or I know I'm just eating that 5th plate of noodles, so to speak. But I'm so afraid that if we slowly undo some of that behavior, I'm going to starve to death. Which is not going to happen, right? But if their body has this like fear of, if you start, right? If I don't constantly say yes to my friends, or if I don't just say yes to my boss, I'm going to be fired. Right? When it's like, we want to find this in-between ground, where it's like, wow, so there's that real fear of, if you don't just say yes and respond to your boss's emails 11 p.m. and 12 a.m., there's this fear you're going to be fired, huh? And I wonder if there's somewhere in between of like, maybe you're really going to disappoint your boss, huh? Let's just talk about like the spectrum of disappointment, because he might be really disappointed. And we could talk about ways that we deal with disappointment. And if you really are going to get fired, what you could possibly do. But let's just even play around with where your brain is going. So I think just like noticing the conflict, right? The inner conflict. The overcoupling piece is kind of like, sometimes, right, in somatic experience, they talk about overcoupling is when like there's this like, I wrote about touch and violation. Like if somebody says like, you know, whenever, every time my husband or my friend, somebody wants to give me a hug, all of a sudden I feel violated. And so with trauma, we spoke about like the past and the present collapse. So even just helping to notice, like coming to therapy, maybe I'm coming to therapy and I'm feeling like for sure you're going to ignore me because sometime in the past when I reached out for help, I was ignored, you know? So even just noticing. Then there's like the clients who get dissociated, going too fast or too slow. One other thing I do want to name is undiagnosed OCD. I didn't learn anything about OCD in my post-grad trainings. And I always saw OCD as much more of like a behavioral approach. And then the past couple of years, I started noticing clients who have like PRO, like either like harm obsessions or relationship OCD, where they would like get obsessed. And I noticed that like doing trauma-informed work or psychotherapy wasn't helping them. And they kept kind of starting to avoid behavior, avoid relationships, avoid engaging with certain like thoughts or feelings. One person almost didn't want to have children. She was so afraid of her thoughts in her head. And so I got advanced consultation. I'm like, from a trauma lens, how do I differentiate between what's OCD and what's trauma? And so I use a lot of Dr. Grayson's work in terms of creating loops, like especially for clients who are stuck in either OCD or kind of like what you're talking about, Frank. Like sometimes clients are stuck in this like obsessive cycle. And I might do like a loop where, let's say I had a client who had this fear of driving because they were afraid they would go out of control, but also they had this fear of being alone forever. Whatever it was, that's what kept kicked up for them. Okay. And so of course, I was working on the core feeling of aloneness, but I also came up with this loop where essentially you create a lot of exposure and the capacity to tolerate uncertainty. So it was something like, you know, when I sit in the car alone, thinking about going out, I noticed this big emotion of aloneness, this fear of I'm going to be alone or I might go out of control. And instead of reassuring myself and telling myself that I won't and everything's going to be okay, I think that might happen. And if it does happen, that would be awful. And it also might not happen. And so I'm going to sit here in my car and tolerate the discomfort. Because essentially what you're doing, even with clients, right? It's the same thing. Like it might be horrible. It might not be horrible. It's already like when clients say they don't want to do the healing work, I'm like, okay, it's going to be uncomfortable, but there's uncomfortable that gets you to less discomfort. And it's uncomfortable that just keeps you there. So, but I can share if any of you are interested, there's specific scripts. And I think when it comes to trauma-informed clients, there's a way to use it. But just creating some exposure so they can actually have a bit more capacity or like know when they're looping and you're like, okay, let's try this script. So we do some exposure so it doesn't have as much power over their mind. Obviously, while this client also had this big younger experience of being alone and then in a cycle of a lot of relationships where people would leave him. And so it was a matter of us also working on the abandonment wound, but also helping get out of that obsessive cycle. And then sometimes what we have is clients stuck in shame. Sometimes the client is lacking support or there's a lack of skills training for the therapist. By the way, when there's a lack of support for the clients, what we do is that we're not saying, okay, you need every single kind of support. But what I might say to a client is like, hey, for this week, I do want to make sure that you have plans for the weekend, or I do want to make sure that you actually are, you know, making sure that you are getting some sleep or some of the basic needs met, because I can't go into this like sophisticated processing if then you don't have someone to cry to for the rest of the week. I might do a little bit less treatment. And if they're angry about that, then we talk about expectations and grief, but then come back to what we're doing. Have any of you guys heard about Sandra Paulson? I love some of her work. Okay, so very briefly, on the left-hand side, this is actually Jack Panksepp talks about some primary emotions. He talks about like the 3 different levels of the brain. I do this exercise, by the way, with clients when they're struggling or when they try to understand like what's the whole point of therapy. So I talk about, as all human beings, there's 3 different levels of the brain. On the bottom, there's these core, right, affective circuits, which is basically just these emotions and how the brain is experienced and develops, which is we have a seeking part of us, we seek. There's lust, there's care, right? We want to care, we want to be cared for. There's rage, anger, something wrong was done to me. There's fear, there's panic, and there's play. These are primary emotions. Even just like I'll literally draw a circle and I'll do 2 lines and I'll say, I want us to draw these core primary emotions. I start noticing for some clients which basic needs were or were not met. Because you might have a client who's stuck in rage, and it's curious because if a little child, a 2 or 3-year-old, is angry and they have a response and the parent has the capacity to respond to the anger usually softens. And even if later on they are a naturally angry child, they learn, I have very big feelings inside. I sometimes have this big angry dragon inside, and it takes a lot of energy, and I have to learn. And these are the ways that I work with my dragon part, right? So it doesn't scare people away or scare myself away. So I think just even orienting to the basics. Now, very simply put, I'm just going to say this. When these core emotions are responded to with a person, right, either in childhood or even in adult relationships, and then especially in therapy, this is the goal of therapy, if there's empathy, right, and there's trust, or there's responsiveness, and there's object relations, right, there's another person there, then what you're going to see is there's going to be pride, right? The person could develop trust. If they are shamed and ignored, or if there's a lack of interconnectedness or responsiveness, they're going to feel guilty. I feel guilty for being angry. I feel guilty for having a need, right? I want to breastfeed. I want to reach. I want to grab my friend's teddy bear. There's going to be shame and blame. And so even on a basic level, sometimes showing this to a client, they feel a sense of relief of like, there's nothing wrong with you. What happened is you kind of got stuck here in some of these core needs, and that's why you're here. So I want us to come back down here, develop a little bit of a different relationship here. I might need to teach you some skills deficit of how do you play? What does play look like in your family or in your life? And how do we negotiate play? Or how do we negotiate lust? Somebody's very pushy. right? Or over sexual or under sexual, right? So teaching them some of those basics so that then they could feel more empathy and trust. Now, this third layer, which is what the goal is for us as humans and for our clients, is we want to help our clients have the capacity to have this neocortical part, which is the capacity to name feelings, which we teach them sometimes with emotional vocabulary. Distancing skills is basically the capacity to notice an emotion, distance myself, and then come back to it, right? Here's this memory, right? What's his name? Jim Knight. Well, they talk a lot about like the back of the head skill when it comes to dissociation. And so, and if anyone wants, send me an email. I have like the PDF on this, but essentially there's an exercise that you have with the client. Let's say you feel like they're very dissociated or they're far away or their eyes are glossy. I'll sometimes say like, you know, if here is that you're fully here in the room, and I put my hand all the way out and I say, and if here, and I move my hand farther back, and if here is like you're really, really far away, you just show me with your hand. I want to engage their body, right? How close or far are you, right? Like, are you here in the room with me, right? Or it's called the back of the head scale, or are you kind of farther away, right? And we want to play with it, right? We want to start noticing how close or far they are. Distancing skills is the capacity to be able to notice an emotion and memory and pull away from it. That's when we use these skills where a client might have an emotion or a memory and we'll say, could you put it on a black and white TV screen? And then I want you to put it in slow motion, right? So you just want to play around with that capacity. There's mindfulness capacities and there's containment. Here, Sandra Paulson actually talks about with some of our clients, like I just spoke about earlier, there could be two different parts that have two different opinions. We want the parts to agree with each other, right? Like I want to be able to work on this part of me that's graspy or needy, if I referenced the client earlier. And I need to make sure that I'm still going to have my core needs met socially. And so in good psychotherapy, we negotiate how we can do the work so the parts can actually like work together. Can't have two parts fighting against each other. But here, Sandra Paulson goes into details where she talks about here's a part that's like afraid, closing out the door, don't come into my dungeon, don't talk about my core emotions, don't make a change. And the left side, there's these fears, there's the soma, the body has flashbacks, there's these implicit memories, there's attachment relationships, there's a lot that's going on that feels like it's at threat. And so just being cognizant of it, I think is really important. For anyone who has to go, I'm going to be, this is good recorded. I'm going to keep going just because I want to be useful, but you'll get a recording, any of you who don't, who aren't able to stay. I'm going to give you an example of Charlie, okay? And I think it's a great example because sometimes clients who represent in a certain way, we don't realize the layers of complexity at play. And we kind of could get stuck and be uncertain about what's going on. So Charlie came in, he's 45 years old, externally successful. And when I say externally successful, I don't want you thinking that you can't relate this to any clients. That means is that there are some parts of their life that are somewhat functional. Okay, so they're not laying in bed, not able to get out of bed. Those kinds of clients usually need either some basic medication management or they need some basic life skills. And I think sometimes, just so you all know, I've seen this for myself, if a client needs some basic life skills, I have to set different expectations for my own self, which we'll talk about at the end with Scott Miller, talks about, you know, outcomes conversations. How do we come up with treatment plans that are realistic? How do we assess for how we're tracking progress? And how can we move with that? But sometimes our clients want to be like 5 steps ahead of themselves. And so as much as I might want to bring them there, I tell them, listen, that's like dead on arrival. Like I'm going to fail, not because I'm not good, but because I don't know how to do the magic. Right? So what I could do is I could bring you from point A to point B. So I'm just talking about Charlie. So we had parts of him that were, he was at work. He actually was like an overperformer, going to work. He was very proud of his work, but he came in not because he wanted to be in therapy, but his wife said she felt very distant from him. He would sometimes emotionally shut down. Also, he had 2 little boys and the boys didn't like spending time with him. He thought he had a great relationship, but he was very disconnected. Okay. Now, he also said, he's like, there's times that I get very angry at work. I'm usually fine, but there's times that I notice I'm angry. I don't say anything. I don't raise my voice. My body gets very tense and my colleagues feel like a little uncomfortable. And at home, instead of me lashing out because I don't want to lash out, I just go away. So my wife will say, hey, babe, I want to talk to you about something. And he's like, I shut down and I hide. And it wasn't like man cave where you hide for a couple of hours and there's parts of you that are absent and you come back in. He would be totally gone. Like he would say, honey, I'm right here. And she's like, no. You're saying you're right here, but you're totally gone. Like I'm talking to this light, this empty, you're hollow. And so he was like, he didn't fully understand it, but he was like, maybe there's a point. I don't want her being unhappy. So help me out. Okay. So there was a big disconnect. Now, somatically, he had a lot of back pain. And for those of you who know Sarno, and I actually once interviewed somebody else who did a lot of research, Dr. David Clark, who's a gastro doctor. They talk a lot of matter of like where the emotions are trapped. And so a lot of anger often is trapped in the back. So as I got to know Charlie, it's interesting because right here, right, I have this picture from Sandra Paulson where she has this like baby reaching up, like arms up. Because sometimes when we talk about like there's some of these basic needs that were unmet, you want to look at like which developmental milestone was unmet in the client that they're now reenacting. Now for Charlie, it wasn't a little child state, but essentially, and I'll tell you the brief way that it came with Charlie. Charlie, I knew that if I'm going to come in and tell him I'm an expert or I could help him figure out his disconnect, he would be like, who are you? You don't know anything. Like, take your time getting to know me. So I said, hey, listen, like you're an expert in this field. So I don't know if I could or can help you, but do I have permission to try? And then we'll see how things are going over time and we'll see if there's a shift, right? And then we track like what would be helpful. So first it was other focus. My wife is happy and my kids actually want to spend time with me. And so I said, okay, that could be an outcome, but I really want us to first work on this feeling of anger that you feel in your body or the tension in your back. And he said, okay, but he was very skeptical. Now, just to give you a snapshot of what was going on is that Charlie never really got to develop when it came to emotions. He didn't have emotional boundaries growing up. His dad was absent a lot of the time, worked very hard because he wanted to perform and, you know, bring home finances. But mom had a lot of sensitive emotions, didn't have anyone to put it on. So she would put it all on Charlie. So they didn't have, some people have very rigid boundaries and other homes, there's very permeable boundaries. Charlie's home had very permeable boundaries. That means is mom would be emotional, crying, angry. Charlie just became a sponge. So he never really had a sense of self and other. So when his wife comes home, right, and she has these big emotions, sad, angry, unfulfilled, whatever it is, he couldn't tolerate being with her because he became blended with them. And so he didn't want to kind of get angry or feel like he's losing himself. So he would just disconnect. And part of our work was developing boundaries of, hi, I'm Charlie. You can have emotions. And when you have emotions, those emotions are not mine. They are yours. I could be present with your emotions. Here's what I could or can't do. Here's how I tolerate my emotional capacity and not. And here's how I can manage the big emotional experiences inside. But it had nothing to do with his wife. It had to do with this young boy right here on the side. He carried a lot of sadness and pain and actual anger to his dad for, hey, daddy, why aren't you there for mommy? And he couldn't say anything to dad. And so a lot of this work was working on some basic boundaries, which is interesting. I'll show you in the next slide. What I've learned was sometimes, you know, there's times where a client comes in with him, you would think, okay, let's work on his relationship with his wife, right? But essentially you want to be thinking about, as I spoke with him, I'm like, really, he doesn't have a sense of self sometimes in relationships when there is an emotional level of activation and he shrivels up and he's this little boy here and he can't be a little boy next to his wife. Right? With clients, sometimes I'll say like, well, who's in the room? And he's like, well, I'm terrified. And I'm like, wait, 45-year-old you is terrified or some other part? He's like, no, this 8-year-old me. I'm like, oh, so there's this 8-year-old that gets woken up when your wife gets emotional, huh? Could me and you work with this 8-year-old? Let's drop the wife stuff. I think if 45-year-old you and me get to know 8-year-old you, I think we might be able to help make a shift. And then slowly over time, it's going to help. Now, obviously, as we worked with his anger, there's some exercises I actually would love to show you guys. Let's see if I could pull it up. In my trauma training, there's a video where I use like a somatic exercise where we almost like practice saying no. And it's not even like, for some clients, boundaries are not a matter. Like with Charlie, he rolled his eyes. I was like, let's try something. And he rolled his eyes. I'm like, look, I just want to see if this will shift. What happened is that he was able to say no at work, but his body never really got to say no. And so with this kind of work, it wasn't that the 45-year-old him had to say no. It was me and him got to know his 8-year-old. When we were in touch with his 8-year-old, he painted a scenario of mom comes home, mom's emotional. She's walking towards me. I start feeling like clogged in my throat. I'm so angry she's coming towards me, but I'm also feeling so trapped and sad for her. And so what's happening is that he doesn't get to share any of those experiences and to be able to either run away or listen or imagine someone else will be there, right? Like what you said, Tom, like, so Frank, so there's this piece of like, what do we do here? So for a young child state, very simply put, is he just needs to share about his pain or his sadness with adults, right? With me as an adult in the room, I could hear his emotions, noticing that 45-year-old Charlie is 45, right? It's this concept of like dual awareness. Like, does little 8-year-old know that you're 45 right now? Right. So even just like that dual awareness. And then what I did is I want you to try, as you're seeing this 8-year-old, I want you to try this exercise with me. And so we had him like stand up and also imagine that he's like standing right next to this little 8-year-old. And there's a somatic exercise where I have the client, I stand up and I say, I want you to very slowly walk towards me. No, you stay there. I'm going to slowly start walking towards you. And as I walk towards you, I want you to imagine, right, you're 45 and there's this 8-year-old boy together with you. And I want you, when it feels like it's the right time, there's no right or wrong, just put your hands up. And I'm going to know to stop. Okay. And then you do it 2 more times where I say, okay, I'm going to walk towards you. And now don't put your hands up, just say the word stop. And then we do it 1 more time and I walk towards him very slowly. And then I say, I want you to say both together, stop, and put your hands up at once. So stop. Right. So this is just one exercise I want you to like, this is what I teach with the client. Now I did it as me. Later on in therapy, as he practiced this, I did it imagining that he was his mother's emotions, not his mother, his mother's emotions. Right. Or there were times like that we did the boundary exercise and really there was so much sadness and grief. So I'm just sharing that there's like specific behaviors that we worked with. Now I do want to bring this one piece up. Okay. And as he worked on the boundaries and he was able to help his 8-year-old self realize that those emotions were difficult and they were hard and they were sad. Right. But we were able to process through them or process through the feeling stuck or the wishes, right? Things he wished he could say to his dad. And also orienting to who his mother, was or wasn't. We made shifts. Now, I will tell you 4 things I do think is important. When we sit with the client, you want to be thinking about, is this a boundary session, right? Does the client either need to have sexual boundaries, physical boundaries, somatic boundaries? You know, I've had a client say like, I told my friend so many times no, and she still comes over. And I'm like, so you're saying no? But as you're talking to me, I notice that your shoulders are a little soft and I don't know if I'm feeling like your body really means no. Do you really not want her to come over? Like what's going on inside? Are you afraid that if you say no, right? So I want to help the client embody that boundary. Or like, let's look at what it means to say no, right? Or like, so a lot of times you want to help them really like either learn something, try something on. With a client, I remember a client once said like, my therapist helps me so much. And her friends are like, well, what does Esther do with you? And she's like, oh, she just helps me stand up straight. And she was joking, but like we played with like the times that she would get very small. And I was like, let's walk around the room and say like, no, I don't want to talk now, or don't come visit me. And she walked over all hunched over. And then I said, okay, let's try it on just with your shoulders being a little taller. And I want you to just say the words, I don't want you to come right now. Love to spend time another time. Just see which one feels more doable. And so I think just like, there's obviously ways to embody it and what's coming in the way, but then there's like the boundaries work, attachment work. Sometimes our clients need a sense of attachment either to us or to someone in their life. Or there might be an attachment injury if somebody's walking around with abandonment wounding, or they never really had object permanency in their life. They never really had someone to lean on. My work with them is going to be really slowly about developing a capacity to take me in as a person, where they're meeting every Tuesday at 2 p.m. And I'm not expecting them to love me or to hate me, just to know that there is some level of consistency happening in their life. And so that's the piece of attachment. Now, obviously, sometimes clients have later attachment needs, and then we do some attachment-oriented work, right? There's like somatic work. There's some kind of activities I'll do, or imagining a younger self, or some emotional needs. Then there's shock trauma. Shock trauma is like somebody's gone through a car accident, if they maybe went through like this recent incident of like divorce or sexual abuse or rape, where there's something more specific and they're coming in flooding with emotions, and we want to do some kind of intervention on that to lessen it. And then there's developmental trauma, where a person might have ongoing layers of either anger, neglect, lacking skills, maybe ongoing sexual abuse. Now, a lot of times we have clients that come in with a few or all. And I think really like discerning clinically, like where am I going? Where am I starting with this client? I will just say off the bat, I almost always start with the boundaries. Even if somebody needs attachment work, I'm going to start with the basics of boundaries of let's talk about our agreement, what my job is here, what your job is here, who's responsible for what, because they can feel secure. And then I might go into some attachment-oriented therapy. where we might, I might say, hey, I want to start drawing a picture. I'm going to start with a blue color. You choose whatever other color you want, or let's start writing a story together. So it really depends on what kind of client and their age. But I think it matters because there's some clients who are just developmental trauma. They feel fine, but they have this empty feeling inside, right? Or they have this repetitive emotions that come up for them.
And one point of your boundary work is to make sure that the word and the body are together, that there is a synchronicity, that when you're saying no, that the body's also saying no.
Yes. I love what you're saying.
Okay.
Yes, I think that the piece of, hold on just one second. Essentially what we're saying, I love what you said, synchronicity, is that a lot of times with our clients is that there's a disconnect. They know a lot of things in their head. You could read 15 books. I know there were times that I read self-help books and they just made me more anxious because it just made the dissonance between what I know and who I am, right? Or my symptoms bigger. So I'm just like, oh my goodness. So you're right. What we're saying is we don't just want to help them understand it or say it. It's like I have clients exactly. Like I had a client say, I don't know what happened. I suddenly have like a really close friend. I'm like, you don't know what happened? For the past year and a half, you're slaving away in therapy. That's like, you're working so hard. You're slaying dragons about like the fears and the pains of, are you deserving of love? And of course you brought an amazing friend into your life because your heart is much more open. And she's like, well, what do you mean? I'm not going to 17 social events a month. I'm like, that's exactly the point. When we do that internal work, it shifts how we are. So the boundary work with him, it was like, instead of telling your wife a million times you're here for her, but really run away emotionally, right? Or instead of repeating that same thing, let's just try an experiment. Let's just try something. And exactly what you're saying, we want to create synchronicity where it's like, let's just notice what's happening inside when you're saying this. Right? Like, does it really feel right? Yeah, like, or let's just really try it so like you can feel it, right? Because there might be a fear of either like, no, I'm really responsible and I feel guilty, or I'm going to be alone, or I'm in danger, right? So we want to get to the core underlying fear or emotion and look at the cognition that we might want to very slowly shift. It could take some time in order to then be able to set the boundary. I can only set a boundary if there's trust about a lot of other pieces. If one of my foundational pieces is weary,
missing,
right? Yeah. Okay, so the 5 pillars to trauma work, I'm going to go through these briefly, but a lot of this is going to be repetitive about what I just said. There's foundations to trauma work, the life and the skills of a trauma therapist, framing sessions, treatment targets, and tracking success. So foundations to trauma work, I think one of the important things is like really knowing your why, your how, and your what. Like, I think any of us in this field, often like we're wounded healers where we have either we had to be caretakers for someone in our life, and so we develop the capacity to nurture, or we have a very empathetic side of us, or we want to understand like the way that the brain and body works. But there's usually a sense of fulfillment. It's a field where we could get burnt out. But when we find the right ways of human connection, of laughter, of balance in our lives, there's something very deeply meaningful about being in this field, right? So there's usually a why, where there's those clients that really are making those gains, and there's some that struggle more, but there's something meaningful. There's how, like, what are my skills? How am I doing it? And what am I doing? Right. And for each client or for each of us, like our skills might look different over the years as we get to know ourselves better and the clients that we work with better. And sometimes as we evolve, we like different things. Like we could say, I love working with separation anxiety. And then, as you do your own work or as you evolve or your own family or personal life changes, you might realize, I love working with disenfranchised grief. Disenfranchised grief is grief that society doesn't often validate, like the pains of either being misunderstood, or somebody not having a child when they really wanted, or having a loss of social status, right? Or some relationship with God or religion or something that really impacts. So we really also shift, right? And then being able to align our own passions with our work. Now, the rule of threes when it comes to trauma work is Vanderhart and Kathy Steele and a few of the trauma experts say, the rule of threes is with a session, and a session could be 45 minutes, it could be 60 minutes, 90 minutes. You want to be orienting to a third of the time, or at least the percentage they're settling in. The second third is that there's processing. Processing obviously could be EMDR parts of it. It could even just be getting into a little bit more of the meaty content of their emotions. And the last third is wrapping up. And it doesn't have to be 15, 15, 15. Some clients need 15 minutes to settle. Some clients need like 2 or 3 minutes, and you can do a lot of the bulk of the work and you wrap up. But I think it's just knowing like, okay, there's like bread, there's the meat or the veggies or whatever is in the inside, and then the other piece of bread. So we're wrapping it up. I remember once having a consultant and I said like, doing these really powerful sessions with the client, and she's coming back and she's struggling with the same darn issue again and again. And she said, wait, how are you ending session? I'm like, look, we're really tight on time at the end. And she's like, you just told me you did such a powerful intervention about staying with the experience of being supported. This was a client who never had proper yield. And I would do this somatic experience where, with her permission and consent, I would put my hands under her arms because I wanted her body to feel like she could settle. She felt like the weight of the world was on her shoulders, okay, emotionally, but also physically. Her husband had struggles, her children, her friends. So I put both of my hands, right, like one here and one here, and I would just prop my hands under hers, and I would say, with permission, can you allow my hands to hold your arms and allow all the weight of the world that you're holding to really just settle into my hand? Yeah, and just settle into it, right? If you're not comfortable doing that, sometimes it's like, could you put it on a pillow? Put your hands on a pillow. I want to support the pillow. And I just want your body to see if for the next minute, you could just settle into the experience of being supported right here, right now, being held with all the things you're holding, right? I'm not here to convince her she's not holding it. She is holding a lot. We did this powerful intervention. She would come in and be like, I need that intervention. You know, she liked it off the bat. It was it helped her calm, it helped her settle, helped her breathe better and feel less alone in the things she was going through. Okay. Obviously, I spoke to her about the intervention. Now she was feeling a shift, but not as much as she needed to. I'm like, wait, why is she still blah, blah, blah? So my supervisor said to me, okay, I want you to try this exercise, and then I want you to really help the client to marinate in it, to embody the experience. So the last third, what I noticed with other clients as well, and it depends, it's like, let's just do a recap. Or let's just notice, could we allow all the cells in your body to take this in? Or, you know, sometimes there's something called a process statement of like, even though I don't have the answer figured out to my relationship, I'm getting clarity one step at a time, right? Or although my child has struggles, or although I'm not sure where work is going to go, I am taking steps to feel stronger about whatever the outcome will be. So sometimes like digesting and offering something that they can take away is really important, right, for the wrap up. The other 3 questions that I often say, there's questions that you want to answer before the client even asks is, am I safe here? What are we doing, right? Where are we going? And does my voice matter? Autonomy. No, client safety doesn't just mean like, am I safe? Are you not going to hurt me? Trauma-informed care is really that we don't do harm, right? And I know this might sound so basic, but like we are sometimes going to have, you know, times where we have ruptures or there's a misunderstanding, but we want to help the client orient to like enough safety in the room in terms of your policies, where you're sitting, how you communicate, how you navigate times they get angry. You invite them to get angry. I always tell clients in the first session, it's not if you get mad at me or upset with me, it's when. And not because I think that you're a mad person, and it's not because I think that I'm purposely going to upset you, but I'm human and I'm going to inadvertently step on your toe, metaphorically speaking. And I really hope to God that, or whatever language you want to say, that if and when you're upset with me, that you let me know, because I want our relationship to be one that becomes real, that you could use our relationship in a real way to help you. This is really practice for the outside world. So, and then clarity is like, what are we doing, right? We're here to talk about your anger. We're here to help you understand better, blah, blah, blah. And autonomy is, does my voice matter? Are you going to listen in? Like, we are collaborative. Now, I might still say, hey, I have an opinion about where I think we should go, but I'm going to listen to what they need and what's going on. The life and the skills of a trauma therapist is really important. Really, we are a container for ourselves, right? Like when we are parents or when we're in relationships, like one of the things we like to do is definitely we like to co-regulate, right? We need each other, we're social creatures. And also we do very well when we are also able to self-regulate. When our clients come in, essentially, they borrow our mirror neurons. They're essentially, like right here I wrote, we're a template creator. They almost unconsciously borrow our demeanor, who we are. Often they don't have parenting figures, or they don't have people in their life that are respectful to them or communicating to them, or working through frustration. I had a client who had a hard time leaving session, and I would say, I'm noticing I'm really frustrated because I find that, you know, you're not leaving session on time, and I'm getting upset because I really need this break right now because I love working with you, but I'm starting to feel a little bit upset. I'm trying to figure out a way to communicate that with you. Now, in the next slide, actually, I'll talk to you about what was going on. She had a very young child state that felt like it was just roaming around when we ended session, and I needed to check back in. And at the next session, we started with, let's talk about what's happening that we can't end session on time, because it's important that I'm able to end session on time and that you are able to as well. So what you're getting in here is enough for the work we're doing, and then we can reopen it. But I think just being able to notice, like, they notice how we interact with people, how we talk to them, how when we're tired. And I think the other piece, I know for my own self, people say, like, what's the best way to become a good therapist? And I always joke, I'm like, I want you to do your own work, you know, like my own therapy, my own consultation, just having someone who can also hold my experience, I think is important. Okay, so here's the framing of the session, right? Framing of the session is kind of like, if there's a photo, here's the frame. The frame kind of holds it, right? And I always say that it's often the secret sauce, because a lot of times people feel stuck and they don't know why. And Sandra Paulson has this great image called the swirling vortex. She says, either you're prematurely doing trauma work, there might be boundary violations, the client's violating your boundaries, you're being either too maternal or paternal transference, or being too loving, overgiving, projective identification, the therapist trends, red flags, projection, right? Transference. So sometimes when we aren't very clear about the treatment structure, things bleed out all over the place. That doesn't mean it's a disaster. It just means, okay, let's get things clear. So a treatment frame is basically, what's the frame of the work? I had a therapist once come in and she was talking about, you know, a client, and I said to her, just help me understand, what's your agreement in terms of finances? What's your agreement in terms of timing? I just want to understand the basics of like lateness. What's your structure? What's your agreement on what you're working on? And she's like, well, we started off working about her relationship with her mom, but now it's about this, that, the other. And so I said, I might sound very old fashioned, but did you guys like agree on a treatment goal? Not that you need to say, okay, we're stopping this and we're going here, but saying something like, hey, I know we were talking a lot about your mom and the sadness around the relationship that you don't have with her. And recently we're talking about your friendships with your friends and how lonely you feel. Is it all right if we focus on that feeling of loneliness that comes up around your friendships? Because I realize how much pain it gives you, right? Now, maybe they're connected, right? Because maybe there's this lack of trust, or maybe there's this fear, or maybe there's a lack of capacity to interact, or there's chronic OCD or anxiety that needs to be supported by the therapist. But being very clear, I think, is really helpful, right? And I think also it retains energy. If there's times that we're unclear, I know for my own self, like a client was saying, they want to do this and this. And so my own savior complex was like, I'll help them with this and this. And it was like, no, I can't help them with their child who has a mood disorder, and also help them with working on some boundaries. It's either let me really focus on one thing very well, or something else, because or else I'm going to be depleted and they're going to be depleted and we're not being helpful. I do think what happens over time is that if you focus on one thing and you consistently focus on it, there's usually a shift. Like I'll find that clients who, right, either there's a trauma belief, or there is a fear, or a memory that they're processing. A lot of times I'll say, I want us to stay on that specific piece and notice some shift, because when we do, there's usually a positive impact in other areas of your life. I've seen that a lot in terms of like if you're working on one specific issue. Okay, so essentially what the clients are asking, right? The 4 is the treatment targets that make sense. Clients are essentially saying, do you see me as a person? Do you see my life? Do you see my suffering, my short-term suffering, and my long-term suffering? Because sometimes we're looking at short-term relief, and sometimes we're looking at long-term relief. And sometimes it's like, hey, you're coming in with a crisis of the week, but unconsciously you have this like, or underneath it, it's that you have this histrionic personality that has this like need for attention or to be very in control. And so every week you have another chaos, but essentially we got to get to the core of this part of you that maybe feels the need to be so controlling, or else there's always going to be the chaos of the week, right? The crises of the week. And I'm not really going to get far, right? So I think it's like discerning, like, are we doing shorter or longer term goals? Or do we say we're doing both, but what are we focusing on most? I will say there are times that clients say, you know, I want to work on, you know, being adopted and the feelings of feeling like a misfit. And also I have really bad social anxiety. And so then I'll assess with them and I'll say, okay, so they're kind of cousins with each other, right? Maybe what's going on, but I want you to better help me understand what your daily life is like, so I could come up with a treatment plan, or we could start focusing on something that's going to help your life for now feel a little better, right? And as life feels a little better, or you can actually socialize because you're feeling so isolated, let's see how that is over the next month, because sometimes there's like a skills deficit, There's some other kinds of work that needs to be done. And then we look at like, do we have to do some of that other work, right? Versus like, I'm pretty okay, but I have this feeling or these things inside my body. Okay, invisible questions like clients always ask unconsciously, but we want to answer them before they ask is, can you help me? How will you help me? And can you hold my hand, right? Don't let go when I kind of like throw a tantrum or if I challenge you or if I ask you about your training. I really just want to know. Now, 5 is this piece that I was talking about earlier. Dr. Scott Miller talks about the research between rockstar therapists to regular therapists, and he says the clinicians who have clients who retain and stay in therapy and say that they're happiest in therapy. There's 65% higher retention. Clients are happier. It's not always because they're the most trained. It's because they engage in outcomes conversations, which means that they have good feedback conversations and they're clear on what they're doing. So it's almost like the client is thinking, how do I know if I'm doing this right? Am I good at doing therapy? How do I know if I'm getting better? And are you tracking this for both of us? Right? Because clients say, how do I know if I should do this, this, or this? And it's like, well, that's my job, right? Dr. Scott Miller talks about, right, people who engage in outcomes conversations have clients who stay in therapy rather than drop out prematurely. They see their outcomes improve rather than staying the same or getting worse. And there's less complaints and there's more evident treatment effectiveness. Now, I do want to say, I don't have it on here. I do want to say there's some very specific questions that's not on here, but there's very specific questions if you follow me on LinkedIn or Instagram, or if you're on my email list that I share, where there's questions where you ask your clients, like after the session, like what was most helpful? What would you want more of? I'm not saying to ask every single session, but I think us getting clear, I know for my own stuff, like getting clear on like the client's pain point and then setting up clear treatment goals really helps clients, one, feel like, oh, I'm doing this right. And 2, they feel more confident in my skills. So if they say we still didn't get there, I'm like, right, of course we didn't get there, but we are getting blah, blah, blah. Right. So I'm also feeling more secure. And from an attachment lens, when we invite feedback, we're developing secure attachment because we can tolerate their questions. Now, obviously, we want to help our clients talk to us in a respectful way. Right? I always say, like, I don't invite bullying. You could be angry, but there's a respectful dynamic that needs to happen for me and for you to work together. But having good feedback conversations or input, I think is really powerful. I've had, just as a group practice owner, even in my trauma training, people give me positive and also constructive feedback. And it's really helped me, like notice what I can work on, what I could or can't do, and who I do my best work with. Like some clients we learn like we're not the best fit for, and others we are. I'm really grateful that so many of you are here. Just very briefly, I know for some who were asking, one of the things that I do offer is a trauma training program. I have a 6-month trauma training program, which I would love to share with you the back end. I blended like my training in IFS. I have a booklet. I've done 2 levels of IFS, and I'm a sensory motor therapist. I did 3 years training, and I'm an EMDR consultant. But it's not that. It's just that I took this approach of like having a creative way of working with clients in terms of trauma treatment, in terms of there's a community of other therapists, there's live consultation groups. And so that's one of the things I offer. There's a trauma training. And then I also have right now consultation groups that we have, therapists where there's a consultation group to get tailored support, to be able to really personalize feedback for your clients and the client work. Right. So I'm going to share with you very briefly for any of you. I know some of you were asking about the course curriculum or just consultation. Just show you briefly. And then of course, if anyone has questions while I kind of pull this up and just show you the back end, I'm happy to answer any specific questions about the slides we just covered, or anything that resonated, anything that's landing for your client or a clarifying question. I'm going to be on here for a few more minutes. How are you doing, Frank?
I'm doing good. Great. I'm enjoying your presentation.
Tell me yeah, go on.
I mean, I have to get used to your speed, but I think it's basically exposing myself more and more to your presentation. I'll get it.
Or I can also try
but you're taping it.
Yeah, I'm taping it.
Which is also very helpful.
Taping it. Yeah, so you could listen again. You can listen again. Hey, I don't see your name, B. Hi.
It's Bianca. Hi, how are you?
There's an echo.
Yeah, there's a little bit of
I
an
know.
echo.
I know. Hang on 1 second. I'm going to turn that. No, it should be better.
Okay.
Can you hear me?
Yeah. Tell us who you
My
are.
name is Beata. Hi.
Okay. Hey.
I just sent you a message about being interested in the trauma training thing.
Okay.
I wanted to know more about it.
Okay. Thank you. So I'm showing you now. Do you guys see the back of my screen? Like my shared screen? Okay.
Mhm.
So what we do is we have like different modules each week. I'll just bring it up to the top. Each week, so there's a course curriculum. For anyone who signs up, you have lifetime access to the knowledge because like you're noticing, Frank, I like giving a lot of information, but I want people to digest it in
I
a
enjoy
pace
that.
that's
Mhm.
Thank you. Yeah.
Mhm.
So we have like every week there's a video that people get to watch with information, right? I talk about like my reciprocal commitment, my commitment to you, your commitment to yourself and your clients being in this line of work. We talk about the basics of boundaries. And then what we have is a case consultation form because we have a live element, 90 minutes. We have every other week a live call where our therapists in the group, like they have a lot of knowledge, but they want to deepen it or personalize it. So people will submit like their case consult. I review it and then we go it over. So either we'll review like a specific client that you're struggling with, right? We look at like helping me understand the format, just structuring it clearly.
Mhm.
And then I give you clinical input and we kind of learn. And then also I might say, hey, I think this client is stuck in toxic shame. Watch this video on module 9, right? And then I want to talk to you about using it. And we have goals here. I track your goals. Or sometimes people want to review like a concept that we're talking about, right? So let's say here I'm talking about module 1, right? There's these booklets with a lot of trauma-informed knowledge or handouts or worksheets you can use with your clients. So sometimes someone might say, okay, let's talk about values-based treatment goals. Or a later module is, here we talk about the 3 primary kinds of trauma and even just like clarifying it for our clients. And then there's like documents that I have. I have a lot of research articles that I find very helpful. I want to pull this up for you. And that clients also find really helpful in terms of like, oh, let me show you this research article that I was just reading on abandonment trauma or on pre-verbal ways that we might have like certain feelings in our body, or psychotraumatology, like when we look at like how trauma was or wasn't understood many years ago. It wasn't even called trauma, right? They would call it the condition of irritable heart. So I'm just showing you, Beata, like here I talk about dissociative traumas, and you kind of get to go through this on your own, and we review a little bit like what's resonating about this information. What do you want to personalize? There's a lot of like scientific like images of the brain that we go through. And then I wanted to show you this video. I wonder if either of you have any of you seen like the backwards bicycle video? It's all about like procedural learning.
No.
So like a lot of what we do sometimes with clients is like helping them understand their behaviors and why they unconsciously go to behaviors. This video is amazing. This guy was learning how to ride his bike and he realized like he wanted to see if people can actually change. I find this very powerful with people struggling with like addiction or certain behavioral tendencies. And so he decided he wants to learn how to ride a bike backwards. So he took the handlebars and it took him 8 months to learn how to ride the bicycle backwards. And then after those 8 months, you see him like performing on stage and how he rides that way. And if he wanted to try to ride the other way, the regular way, he couldn't. He kept falling off. His body couldn't handle the balance. Then he takes his 3 or 4-year-old son and he teaches his son for the first time how to ride with the handlebars backwards. And his son picks it right up. And this talks about like when we talk about transgenerational shifts, or if you want to shift a neural network in your brain, right? Or if a client says, instead of like, engaging in a certain behavior or going to this negative thought process or reaching for alcohol, I always say, I can't expect you if you have a paved out pathway in your brain, we're not going suddenly, if you go to right, to go to left. I want you to even start having some conscious awareness, like, wow, I'm going for that bottle, right? Or start noticing the emotions or noticing for the impulse. Obviously, over time, I want you to be here. Like they talk about the choice points, like developing more capacity to notice your choices. Let's notice that you can just pause. Slowly over time, I want you to be able to shift, right? And to notice where you go. But I think like just even learning and teaching some of these clients, like showing them either videos, and helping them process through. There's a lot of videos where I like teach you about like, reading your client's body language. There's a book called The Body Reveals. Like we help our clients here. I think there's images I have here of like how the body expresses trauma. Like even just understanding if your client is stuck in like this either burdened stance, or in a stance where they feel kind of stuck or trapped. And then somatically, there's like behaviors and exercises that I use. It's pretty thorough. I don't want to like overwhelm you, but basically like even knowing like some clients laugh, they're like, you just want me to have a better body posture. I'm like, actually, if your muscle tone shifts in our work together, right, then there is a shift. Because like, let's say even here, this person's like hunched over. This person's leaning forward. She looks like she's about to fall. This one needs to like push herself out like a peacock, right? Or else she's not going to be heard. This is a bit more balanced, and this is what we're going for. And so it's always interesting to look at like, I have other images of like if you look at the body, here's Pat Ogden talks about, right, how psychological capacities and beliefs are inextricably linked to the structure and movement of the body. Now, I'm not going to work directly on the body right away, especially if a client's uncomfortable, but I'll start noticing themes in their life. And I might say, could we try an experiment? And I'll try a somatic experiment, which I teach you. Oh, here's one of the images. Like you're looking at what are the forces and how were they responding to some of the forces or relationships in their life. It could be more societal, ongoing trauma or shock trauma or stress. And then you'll see like themes about how we're shifting. We want to shift the body-based messages. And then there's like working with the shame, but it's pretty robust. We work on like, there's exercise. Oh, here's the boundaries one. Yeah. Here's the boundaries. So you get lifetime access. Like people, some go through it like every other week. Some people go through it over a year. I'm pretty much in touch with most alumni. So here's like what I said. There was like that exercise. I'm going to silence it, but I show you like, there's a lot of videos where I record ways to interact with like the boundary exercise. I think here's the one where you're walking towards the client and just like a script of what you can say. And then there's boundary exercise with objects. Like I show you how to do like, use like specific like ropes and strings. And then we have like papers, like internal and external messages. Right. So anyway, I geek out on like the neuroscience on the brain stuff, but then also practical implementations, because I think that's where we really learn. But yeah, any questions besides Frank? I'm going to channel you in my sharings because I do want to be able to pace myself. But I'm so glad that you're all here so far. I'm curious, any last questions, comments, anything to keep in mind for future trainings?
This was really helpful. Thank you so much, Esther.
You're so welcome. What do you find? What was most helpful about this, Lindsay?
Just the refreshers about having the structure around the sessions, because sometimes that needs to be revisited with clients. It is very easy for them to get caught up in, like you said, the crisis of the week. That is something that I see very, very often. And sometimes it can be challenging to kind of reel them in without there being tension. Because they want to talk about the crisis of the week, and I want to redirect them to focus on the thing that they want to work on. But it's a little tricky because it's like it's their session. So it was really helpful. It's a really helpful reminder to do that, and affirming that I'm not wrong for redirecting them in that way.
You're not wrong. And by the way, sometimes like buy-in is like, sometimes what I'll say is like, I need to get buy-in, right? And sometimes it's like, we're not in a shaming way, but it's almost like, I wonder, like when we worked on this and this, I noticed a shift in your mood or in the way you were able to do X, Y, Z. And you link it up and you say, I wonder if it would be okay for us to do some more work on that, because I think that's what helped you last time. Do you think that's okay? Like, I wonder if there's a way that you can get some buy-in and then guide them there. I don't know if there's a specific client you're thinking of.
Yeah, no, that's helpful. It's like, you know how you know something and then you forget it
Yeah.
and then you need the reminder. So that is what this was. It was just a perfect reminder of get buy-in, go back to the basics. Sometimes it's about going back to the basics. And so that was incredibly helpful. I loved everything you talked about, and I'm so glad that I saw this and I hopped on. So thank you. Thank you for all the work that you're doing.
Thank you. Thank you for being here. Appreciate it.
I really appreciate that too. It's Beata. Hi. I really appreciate everything that you talked about. I like specifically like focused on what stood out to me is that like you're asking permission from the client, giving them the choice. And sometimes it's easy to forget, like, because there's, you know, power dynamic and like just making the patient comfortable enough to make choices and letting them feel like they're making choices and their decisions. It's so crucial. And also that's what I work with trauma on with clients, is like those three things that you mentioned: safety, clarity, autonomy. That's like really, really sums up what like the trauma for me is about in session. Like developing your own voice when you didn't ever have your voice, and how hard it is, acknowledging how hard it is. And also like the sense of safety and not living in fear like all their life. Like that's such a difficult shift, not to be in fear anymore. That's an automatic response, you know?
Right.
It's almost like, and also being in the present, just the mindfulness of the moment. And I mean, that's so important. Like when we do working with patients, it's so easy to drift off to the background and talking about the trauma and talking about where they're gonna be and talking, but like to bring them in the present and feeling what's going on for you now. It's so important.
Yeah. Yeah, I love that you're sharing that. Right, because sometimes it's like, are we going to do work on helping them be more grounded, or do we also want to notice that there might be a part that's dissociated or living in trauma time, and do we actually maybe need to do some work on processing the part that's living in fear? And then, right, create dual awareness, and then maybe do some, like, sometimes clients who are very dissociative, it's like, I want to help orient that part that this danger is no longer there, but maybe find a way for it to process through some of that panic, because it still feels like it's happening. And we want to bring it out of the past, right? And so, right, if clients feel like a lack of safety, it's usually because there was a lack of safety and the body doesn't yet fully know safety. And we want to slowly help the body feel into the safety, not just know it. So that, right? Like
it's really,
yeah.
It's a thin line between where to intervene and when to bring to the present and when to stay in that fear. Like you can't really stay in the fear. Like you can't really stay in the fear too long, but you also have to know when to go into that fear and not just be in the present all the time. So it's really like a big skill to have.
Yeah, I think that's where, like, I've done so many trainings and consultations, because I feel like that takes clinical nuance of like, is this the place where I'm going to say, okay, let's work with this specific part of you, right? That's feeling the fear. So I think that is like more of like that clinical nuance that we develop, right? Like over time. I know you said you're interested in the training. We're going to send an email after this for anyone who's interested in joining our consultation group or training. I love the groups, really awesome, reflective people, also very humane and humble, like we're talking about this. But also, like, you know, skilled and doing good work. So I would love for you to join.
I like that, because this is, you know, you just gave me a spoon of something very delicious, but I haven't taken all in. Like I need more of it.
Yeah.
So I appreciate that you will send that information over to us.
Yeah, definitely will.
Thank you.
Thank you all for being
here. Okay.
Really appreciate it. I'll send out a recording, and I hope you have a lovely rest of your day, wherever you are.
Thank you.
Okay.
Thanks so much. It was great to meet you.
So welcome. Thank you.
Bye.